Hello everyone, in this video I will tell you about another medical condition which is known as the hypertension. As you can guess from the name, hypertension means a condition of raised blood pressure. But how much blood pressure should be raised? The blood pressure should be 140 by 90 millimeter of mercury. 140 should be the systolic blood pressure and 90 should be the diastolic blood pressure. Systolic is that phase of the cardiac cycle in which the heart pumps blood to all parts of the body, and diastolic is the filling phase. In this video, I will tell you about the stages of hypertension, the types of hypertension, the clinical features, signs and symptoms of hypertension, the complications of hypertension, risk factors and management of hypertension. So let's start. First of all, talking about the stages of hypertension, hypertension is categorized into the three stages, which are the mild, moderate and the severe. These three stages are categorized according to the duration of the condition. Okay, now talking about the types of hypertension, hypertension is classified into two types. The first one is the primary or the idiopathic, and the second one is the secondary. The first type, which is I have told you, is the primary or the idiopathic. Idiopathic means those diseases whose exact mechanism is not known. We do not know what causes these diseases. So the primary hypertension or the idiopathic hypertension, about this we know some precipitating factors, which are some genetic factors, obesity, heavy alcohol intake, heavy salt intake, or the cigarette smoking. About the secondary hypertension, they occur secondary to a disease. Secondary hypertension can occur due to any renal disease, any endocrine disease, any cardiovascular disease, or any neurogenic disorder. Okay, now talking about furthermore about the blood pressure. Blood pressure is cardiac output into the peripheral resistance. Blood pressure means the rate of blood flowing through the body, which is the sum of the cardiac output and the peripheral resistance. Okay, now talking about the risk factors or the causes of the hypertension. The risk factors of hypertension are classified into non-modifiable risk factors and the modifiable risk factors. The non-modifiable risk factors are those which we do not have any control and we cannot change them. Talking about the non-modifiable risk factors, these include the genetics or the family history of hypertension, increasing age and the male gender. These are the non-modifiable risk factors. Now talking about the modifiable risk factors which we can change are the cigarette smoking, obesity and the alcohol intake, and some lifestyle modifications. By modifying these risk factors, we can either prevent hypertension, or if we have been diagnosed with hypertension, we can manage hypertension. Okay, now talking about the complications of hypertension. Hypertension has various complications. Hypertension affects every system of the body. First, talking about the central nervous system, the hypertension causes a severe stroke in the patients of hypertension or the subarachnoid hemorrhage. It also causes retinal damage, which will commonly result as visual loss. It can also lead to heart diseases, which can lead to further heart attack. It can also lead to kidney disorders, which will lead to kidney failure. Okay, now talking about the management of hypertension. Hypertension has also two management categories. The first one is the lifestyle modification and other is the medication. Firstly, talking about the lifestyle modification, there are some measures which we can take to prevent hypertension. The first one is the weight reduction. Then there is reduction in the alcohol consumption. Then there is a stoppage of the cigarette smoking. We should take reduced salt intake in our diet, and we should avoid stress. Talking about the medication management of the hypertension, there are some classes of drug which we can take. The first class is the diuretics. The diuretics reduce the sodium and water content in the blood, and therefore they reduce the cardiac output. The second class of the drug is the beta blockers. The beta blockers also reduce the heart rate and the cardiac output. The third class of drug is the ACE inhibitors, which also acts on the different hormones in the body to manage our blood pressure. I hope you got a better understanding of hypertension. In the end, I will quickly summarize all the points I have told you. Hypertension is the condition of raised blood pressure. The blood pressure should lie within the range of 140 by 90 millimeter of mercury. It has three stages: the mild, moderate, the severe. Two types: the primary or the idiopathic, which exact mechanism we don't know, and second is the secondary, which occurs secondary to a disease. Then there are some clinical features and signs and symptoms you can see in the image. There are some risk factors, modifiable and non-modifiable. Then there are complications you can also see in the image. And then there is management. There is first one is the lifestyle modification, and the second one is the medication. I hope you got a better understanding of hypertension. In this video, if you have any query, you can ask me in the comment section. If you like my video, give it a thumbs up and subscribe to my channel. Thank you for watching.